السلام عليكم. اليوم راح ناخذ اميون باثولوجي. انا الدكتور بسام محمد حميد، خريج طب النهرين سنة 2000، يعني بيني وبينكم 24 سنة حاليا. راح نبدي ناخذ مجموعة من المحاضرات اللي تتعلق بالاميون باثولوجي. شنو هي الامراض التي تتعلق بالاميون سيستم؟ mainly relating this to disease and pathology, not much to molecular mechanisms or cell types. Our topic today about hypersensitivity reaction. This is condition when the body have exaggerated immune response against antigen. In usual conditions, immune system as a defense mechanism, it will attack any foreign antibody. But when this immune system attacked or react with foreign antigens in a severe way that lead to tissue damage, this is called hypersensitivity reaction. Learning outcomes. At the end of these lectures, you should be aware about the importance of hypersensitivity reactions. Hypersensitivity reactions, very common conditions, very common disease. You can see it in medicine, in surgery, in pharmacology, in pediatric. You should also know the types of hypersensitivity reactions and correlate that with the clinical examples and clinical scenario. You will be a doctor. So relating pathology to signs and symptoms and disease pathology is very important. This is main aim, is to correlate pathology with the clinical findings. You should pay attention for this during studying and during exams. This picture, what we see in this picture, patient suffering from respiratory distress and taking inhaler. This is asthmatic patient. Asthma is one type of hypersensitivity reaction. It's usually related to what is called hypersensitivity type 1 reaction. Hypersensitivity type 1 reaction is one type of hypersensitivity when foreign antigens, usually pollen, dust, hair, animals, exercise, these lead to stimulation of immune system that in turn will produce IgE, a type of immunoglobulin. IgE will look for a mast cell. Mast cell have receptor for IgE. When IgE bind to these mast cells and rest, this is what is called the initial phase. In hypersensitivity reaction, always we have two phases. The sensitizing phase, when the first antigen enters the body and forms the antibodies. And we have the secondary, the challenging dose that lead to reaction. So patient exposure to dust, for example, have sensitized those and forming IgE, coating all mast cells. When he re-exposure to dust, a second antibody will bind to IgE and cause degranulation of mast cells. So what mast cells have? Mast cells have what is called primary mediators and secondary mediators. Primary mediators, mainly histamine and other mediators, cause bronchospasm, smooth muscle spasm, increase in mucus secretions. So the asthmatic patient, what will have in the bronchial tree? He have spasm in the bronchial tree. He have increased mucus secretions that plug and close the bronchial tree. So bronchial tree are closed or narrowed. So usually asthmatic patient have apparent sound, what is called wheeze. صفير. هالشكل يجينا المريض اللي عنده الربو. فwheeze patient usually present with wheeze because of bronchospasm and have productive cough. White or cough, yeah, there's no infection, so white mucus cough. Another conditions, anaphylaxis. Anaphylaxis when we have a foreign antigen sensitized by the recipient entering the bloodstream. This causes hypersensitivity type 1. What we will have? We have mast cells degranulations. Mediator will be released. We have three things: muscle spasm, vasodilatations, and an increased mucus concentration. When the reaction is systemic, we have systemic vasodilatation. What will the patient will have? We have low blood pressure, what is called anaphylactic shock. Anaphylactic shock. That is to say hypovolemic shock because of extensive vasodilatation. This is another type of type 1 hypersensitivity reactions. Type 1 hypersensitivity reaction usually called as immediate hypersensitivity reaction. Why it is called immediate? Because it is rapid, occurs within minutes from the exposure. What we need allergen, we need plasma cells producing antibody. Which type of antibody? IgE. And we need mast cells. Mast cells will become degranulated and secrete these mediators. This is diagram showing the hypersensitivity reaction. You see allergen, plasma cell stimulation, IgE production coating the mast cells, second exposure, mast cell degranulation and secrete mediator, what is called primary mediators and secondary mediator. Next picture, what is this? This is what is called blood film. Blood film, that is blood smeared on glass, called blood slide glass, and this is the test called blood film. We see the morphology of red blood cells on a slide. What we have these here? We have deformed RBC. We have, look to these circular RBCs. These are called spherocytes. Why we are discussing this now? These spherocytes and storage features of autoimmune hemolytic anemia. Autoimmune means the body producing immune reaction against its own tissue, usually IgG. This is a type 2 hypersensitivity reaction. In type 2 hypersensitivity reaction, there is antibody-mediated destruction of tissue. In type 1, also antibody, but we need mast cells. In type 2, we have three mechanisms for cell injury. Either the antibody bind to the antigen cells, which is in this case RBC, and this stimulates complement system. Complement at the end will form what is called complement attack complex and causes lysis of cells. In this condition, autoimmune hemolytic anemia. The second mechanisms may be the antibody cause opsonization of cells. A diagram of type 2 hypersensitivity reactions, allergen, plasma cells stimulation, antibody, usually IgG and IgM, and these antibody cause destruction of cells either directly with the aid of complement system or direct lysis and opsonization of cells, meaning that antibody mark the cells and there will be phagocytosis by macrophage, natural killer cells, neutrophils, sometimes eosinophils. All these cause destruction to cells. Sometimes these antibodies not causing damage and inflammation, but it is change the function of cells, what is called functional derangement of cells. Here, the antibody bind the receptor, either inhibit the receptor and inhibit the cells, or the antibody bind the receptor and cause stimulation of cells. What we see in this picture, what is the most prominent finding we see here? The exophthalmos, the eye, the lid retraction. This protruding eye is a feature, the sign of thyrotoxicosis. Thyrotoxicosis is one of the pathology that occurs to the thyroid gland. What is related to this in our subject? Because thyroid gland, as you know from physiology, need thyroid stimulating hormone, need TSH for stimulation. So what we have here, the body produce antibody that have similar action to TSH. The antibody will bind the receptor and cause stimulation of the thyroid gland. This leads to increased thyroxine secretion and this will lead primary hyperthyroidism, also what is called Graves' disease. Graves' disease is a type of hypersensitivity reaction lead to cellular hyperfunction. What we see in this picture, what is called ptosis, weakness in the muscles of the eyelid that lead to eye drop. In these conditions, the antibody is blocking the acetylcholine receptor. The acetylcholine receptor is needed for neuromuscular transmissions. So when we have antibody blocking this receptor, this leads to muscle weakness, usually proximal muscles, shoulders, hands, and lid muscles. This diagram shows the thyroid stimulating hormones antibody causes stimulation of the thyroid cells, lead to increased thyroxine secretions and thyrotoxicosis. The inhibitory effect, the antibodies blocking the acetylcholine receptor and cause muscle. In type 3 hypersensitivity reaction, also we have antibody is a major cause for this injury. Type 3 hypersensitivity reaction is called immune complex reaction, in which there is exogenous or endogenous antigen. Body will produce antibody, and so we will have antibody antigen binding, forming what is called immune complex deposition. Immune complex deposition, if it's too small, will be filtrated in the kidney. It is too large, it will be phagocytized by macrophage. If it is medium size, it will be deposited mainly on vascular organs, lungs, kidney, skin, synovial, and tissue and joints. When we have immune complex deposition, this will lead to activation of the complement system, chemotaxis of inflammatory cells, neutrophils, and will have acute inflammation. This in turn will lead to tissue damage. So type 3 hypersensitivity, we have immune complex. Main immunoglobulin involves IgG and IgM, and formation of immune complex that lead to tissue damage and inflammatory response. Shows what is called tuberculin test. Tuberculin test, when we take part of tuberculous antigen and injected inside the dermal tissue. It is example of type 4 hypersensitivity reaction, what is called cell-mediated hypersensitivity reaction. Cell-mediated hypersensitivity reactions in which the cell is the major cause of injury, either T helper cells, and as in this condition, that will lead to secretion of cytokines and formation of granuloma tissue, or we have cytotoxic T lymphocyte CD8. This usually occur in organ graft rejection. Type 4 hypersensitivity reaction, also called delayed type hypersensitivity reaction, because it needs about 62 hours to develop. So need times for reaction to develop. Diagram shows type 4 hypersensitivity reaction. We have antigen entering the body, stimulating the T helper lymphocyte. T helper will form memory T helper cells. So when we have second exposure, this T helper will cause damage either in two ways, either through cytokine secretion and will act on fibroblast, macrophage, and choroidal cells, lead to formation of granuloma tissue and tissue injury, or activation of cytotoxic T lymphocytes and cause direct tissue damage to the organ. This is the end of our lecture. Hope you find it well. تجربة جديدة يا شباب. أحتاج فيدباك من عندكم على التجربة بشقيها. هذا الشق اللي هو حيكون تسجيل، والشق الثاني اللي حيكون clinical application case scenario discussion. إن شاء الله نشوفكم خير وسلامة ونبتعد عن الإلكتروني. شكرا جزيلا.